Nervous system regulation through listening, the science and applications. This is from Unite Health. Real-world evidence. Real-world evidence relies on health data from sources outside of clinical research settings, including electronic records, registries, and technology products, including personal devices and applications. This data can be used to better understand the safety and efficacy of health-related products and services. As compared to traditional clinical trials, real-world evidence has unique benefits and limitations. Real-world evidence. Settings are more representative of how people behave in the real world. Limits bias through very large sample sizes, transparency in reporting, and acknowledgement of mediating variables. Generates larger data sets more quickly. Easier to generalize to diverse populations, can contribute to and/or inform clinical trials and professional use. Clinical trials account for natural variation through highly controlled environments and procedures, limits bias and chance by controlling variables and narrowing eligibility criteria, longer timelines for completion, more difficult to generalize beyond study population, can include and/or be informed by real-world data. The real-world evidence reported by Unite Health has been collected by providers who administer third-party developed standardized measurements to their clients using the Unite Assessments digital platform. All reported data is de-identified, does not contain PHI, and only reported in aggregate. Consistent with best practices for real-world evidence generation, these reports do not control for other therapies, medications, or contextual variables that may influence outcomes. These data are representative of real-world settings. In addition to real-world data from standardized assessment tools, Unite hosts a database of provider-submitted case studies that describe the context of delivery and related outcomes following the completion of Unite products across a wide range of disciplines, modalities, client presentations, and settings. As the clinical trial evidence for Unite products continues to grow, case studies provide important insights into the unique factors of delivery across diverse populations, creating a foundation for further research and informing the development of practice guidelines and resources while shedding light on the aggregated data reports. Many clients who experience the SSP report fewer symptoms of anxiety. In a real-world data sample, 752 clients reported at least moderate anxiety symptoms in the G87 before starting the SSP Core program. Following completion of 5 hours of SSP Core, 85% of the clients experienced a score improvement. 63% of the clients moved from clinical to non-clinical level. The average score of the G87 decreased from 14.6 of high severity to 8.6 mild severity, an average reduction of 6 points. Many clients who experience SSP report fewer symptoms of depression. In the real-world data sample, 543 clients reported at least moderate depression symptoms on the PHQ-9 before starting the SSP Core program. Following completion of 5 hours of SSP Core, 81% of the clients experienced a score improvement. 53% of the clients moved from clinical to non-clinical score level. The average score on the PHQ-9 decreased from 15.3 high severity to 9.8 mild severity, an average decrease of 5.5 points. Many clients who experience the SSP report fewer trauma-related symptoms. In a real-world data sample, 390 clients reported at least moderate trauma-related symptoms before starting the SSP Core program. Following completion of 5 hours of SSP Core, 87% of the clients experienced a score improvement. 57% of the clients moved from clinical to non-clinical level. The average score on the PCL-5 decreased from 45.4 severe to 29.2 moderate, at a 16.3 point improvement in symptoms. Caregivers of children who experience the SSP report fewer psychosocial challenges. In a worldwide data sample, caregivers of 219 children reported at least some challenges of psychosocial functioning before starting the SSP Core program. Following completion of 5 hours of SSP Core, 84% of the clients experienced a score improvement. 47% of the clients moved from impaired to not impaired category. The average score on the PSC decreased from 36.3 to 28.7, a 7.6 point improvement in psychosocial challenges. Research in progress. Building upon the foundational evidence on how music affects the brain, body, and nervous system, the research on Unite programs continues to develop and unfold. There are developing studies on adults with PTSD, chronic pain, breast cancer, ADD, depression and anxiety, older adults with Parkinson's disease, young adults and adolescents with Ehlers-Danlos syndrome, and children with a history of trauma, anxiety, and autism. A study measuring the impact of the SSP on auditory hypersensitivity, autonomic state regulation, auditory processing, social behavior, and middle ear muscle transfer function in children with trauma history is completing data analysis with promising early results. Further, a study looking at the impact of the SSP on developmental function in an early intervention setting has completed its initial phase with plans to publish and expand the study in 2024. Summary: the potential impact of music and sound in the world of therapy and wellness is quickly gaining traction. Unite looks forward to contributing to the scientific and clinical expertise of listening therapies as a thought leader and collaborator, ultimately fulfilling our purpose to transform the lives of children and adults every day through empowering therapists, educators, clinicians, and healthcare providers to guide their clients to think, feel, and connect better through improved nervous system regulation.